Hey guys, have you been experiencing soreness, achiness, throbbing, maybe some burning or severe pressure in the front of your shins? Well, if so, let's go over one of the range of motion tests that we would use in the office for someone who presented with these types of symptoms. So the name of the test we would use for these types of symptoms is called the PK test. I'm going to show you what that looks like, and then I'm going to have Joe come in and perform the test, and we'll break it down a little bit further. Essentially what you're going to be doing is you're going to be getting on the floor as such, and you're going to try to keep your ankles flat, and you're going to try to sit down onto your heels just like this. Okay guys, so Joe is now back in the position. So 100% full range of motion for this one is going to be the front of the ankle and the shin flushed flat against the floor. So if I go and measure on Joe, I'm not able to fit a finger in between his shin and the floor. I can't get them through. So that's 100% pass. Do you have any symptoms?
Nope.
Nope. So no symptoms. Full range of motion and no symptoms is what you ideally want in this position. So let's see what failing this test would look like, or less than full range of motion. So if I were to take my fingers here, okay, as you can see, I'm able to fit my fingers between Joe's shin and the floor on this side. Not much, about half a finger. So the more fingers you can fit in between your shin and the floor, the more dysfunction that is present. And then we would check again to see if there's any symptoms.
Yeah, I have some pulling in the front part over here.
So if you notice that your symptoms are reproduced in this position, then that's a provocative test, and that gives us a lot of information to work with. So if you guys are having symptoms in the front of your shin, the front of your ankle, I encourage you to give this test a try at home and see if you're able to pass, or if the test reproduces any of the symptoms you might be experiencing. If it does, or you fail the test, give us a call or send us a DM, and we would love to talk to you. Till then guys, ciao for now.